Let's have a look at the third video of this treatment for edema, lymph drainage, or in a simple way, edema treatment. We're looking at the treatment of the foot now. Having done the thigh, the knee, the lower limb, we can start to treat the edema of the foot. Foot edema you very often find behind the inner malleoli. You find it on the back of the foot or even on the sole of the foot. So let us start with the inner part of the foot. I'm starting a little bit behind and above the malleoli with this 2-3 finger technique. Hold the foot gently and work around the malleoli. I take time. What I show here in a few seconds I will do in 3-4 minutes. Shift the liquid up here. Sometimes it helps with a gentle stroke going along the tendon and bring the liquid up to the lower limb, like this. And you will feel the resistance in the tissue. As more resistant the tissue is, as more slowly you move on. In orthopedic edema treatment, we use this technique a lot when we have people with distortion on the ankle, ligament tear, contusions. Very often they have chronic edema. Taking off this edema, pain will be relieved. So we have the circling and the gentle stroke. Let's look down. I move it like this. Circling, and I try to bring the liquid here on the inner arch to the malleoli. Start on the middle of the foot and slowly work through until you are on the base of the toes. A gentle stroke with your thumb like this can be helpful afterwards. This region here on the inner side of the heel you can do with one thumb technique. Bring the liquid up behind the malleoli. Let's always bear in mind the lymph system has little intrinsic pressure. Therefore, the stroking, the technique, shall be very gentle and soft. Now we have done the inner part and the sole of the foot. We are coming to the outside and the neck of the foot. Almost you find edemas here. So start with double thumb technique, bringing the liquid up here, or even with the circling technique. And double thumb again. For the toes, very often you will find edema here. Work gently with one thumb technique. support the toes with one hand, and the other hand can work to take off that liquid. Before you can relieve the toes from liquid, you have to relieve the dorsum of the foot from the liquid. Otherwise, the liquid cannot go on. And the outside of the foot you do as we showed before, circling technique starting above malleoli. Or the strokes. Now let's remember a basic rule. Always, before you drain the swollen part, drain the part above. So if I have swollen foot, I have to work from the knee down first. The vessels will be empty, so the liquid from here can come up. If I have a swelling until to the knee, I have to work first the thigh, so that the vessels are empty and the liquid from the lower limb and from the foot, they can come up. If I've worked a lot on this part, I have to go back and to work on the thigh again, so that liquid which has shifted up there will be shifted up to the belly. So the rule is drain always the upper part before you really work on edema. If we have an edema comes up above the knee, always start on the groin and work through down. If it is only a foot, we can start up here at the knee. The deep breathing on abdomen is always good. If the edema is the whole leg or the lower limb or the feet, anyhow, it is helpful, it's activating. Elevating the foot with a pillow is helpful too. In summertime, when it is hot, do 2 times a day a cold shower. Just sprinkle cold water on the leg, maybe with the tube in the garden. It will somehow tonify the vessels and will be helpful. Be careful not scratch your edema leg. If we have a lymph edema and it will be scratched, it can become a huge infection, which we call erysipeal, and needs for months then antibiotics. Therefore, whenever we have a swollen leg, be careful not to stretch, and there shouldn't be made a traditional medicine application which are scratching the skin, because the risk of infection. If you're working somewhere on the fields or where there are stones, protect your leg. Your swollen leg should be protected so that you are not scratching varicose veins or the lymphedema and so on. Avoid to have tight trousers or tight socks. They will somehow squeeze the vessel and it won't really flow well. What you can do from a point of nutrition, eat regularly vegetable soup with onions. It will help you to drain out the liquid. Or nettle tea. In Lesotho it's called the bobatsi tea. Helps to drain out liquid from the tissue. Drink regularly this tea. It will be helpful to your treatment of the edema.